Good morning, everyone, and thank you for being here today to mark a very important milestone for the Protect MB COVID-19 vaccine campaign. It's an honor to be gathered here back in the place where we started the Protect MB campaign, and exactly 1 year later. I'm here on behalf of all Manitobans to extend my gratitude first and foremost to Dr. Brian Sharkey and Lori-Ann Laramie. These two Manitobans stepped up in an incredible way to kick off our vaccine campaign and to show leadership by promoting the COVID-19 vaccine. Dr. Sharkey was one of the first Manitobans to be immunized. He is a practicing family physician working in the Victoria catchment area, in hospitals, assisted living, and home sites for 40 years right here in Winnipeg. He's also married to a doctor, and together they have 5 adult children who are also practicing doctors and 1 who is a medical engineer. We couldn't choose a more qualified individual to encourage Manitobans to get vaccinated. Thank you, Dr. Sharkey. And Manitobans would have a difficult time getting immunized if it wasn't for all the health professionals in Manitoba who have stepped up to join the fight against COVID-19 and have provided the vaccine to over 2 million Manitobans in every corner of our province. Lori-Ann Laramie is a longtime public health nurse, and she immunized Dr. Sharkey on this day a year ago. When COVID came and the need arose, Lori-Ann changed gears in her career, and she now serves as a clinical lead of the province's Vaccine Implementation Task Force. Prior to joining the task force, she was involved in research into vaccines, and she worked in ICU at Children's Hospital and at Manitoba Institute of Child Health. She's a mother to 3 children, a 26-year-old daughter and 18-year-old twin daughters. Together, Dr. Brian Sharkey and Lori-Ann Laramie made history here in Manitoba. Thank you both for coming to join us today to mark this occasion and to accept our appreciation. I want to pause to thank all healthcare workers, those on the front line, and those who make it all work behind the scenes. Their commitment is commendable, and they are keeping Manitobans safe throughout this pandemic. My gratitude also extends to the University of Manitoba and Michael Benarosh. I appreciate the university's generosity in allowing the Protect MB campaign to begin here and allowing us to return a year later. The partnership between the province and the university and many other organizations are a driving force behind the Protect MB campaign. I also want to thank the province's Vaccine Implementation Task Force, whose work behind the scenes makes it possible for Manitobans to be protected, for our communities to stay strong, and who help to ensure our healthcare system is capable of weathering this storm. We've administered over 2.5 million doses in the past year, thanks to the hard work of the people here today and many, many others. Every time someone rolls up their sleeve and gets the COVID-19 vaccine, we all get one step closer to leaving this pandemic behind. But the fight is not over yet. Everyone must get the vaccine as soon as they're eligible, and please, please encourage your family, friends, neighbors, and coworkers to get fully vaccinated and get a booster dose as well. I received my 3rd dose of booster yesterday from Dr. Reimer, and it's a relief to have the added protection and immunity, especially in time for the holiday season. The best time to get your booster is now. Call your doctor or nearest pharmacy to book an appointment, or go to the protectmb.ca to use our vaccine finder map. Finally, I want to thank every Manitoban who has rolled up their sleeve and received their vaccines, including their booster doses. Your cooperation with the Protect MB campaign is creating a better future for all Manitobans. Now I'll invite Dr. Joss Reimer to make a presentation and to say a few words.
Thank you, Minister Gordon. My name is Dr. Joss Reimer. I am the medical lead of the province's Vaccine Implementation Task Force. It is a pleasure to be able to join with all of you today as we mark 1 year since the beginning of the provincial vaccine effort to protect Manitobans against COVID-19. It is hard to believe that a year has gone by, and yet we still have so much work to do. I think it's important to mark our campaign milestones, even in the midst of difficult challenges and while all of us are looking ahead in the days to come. While we plan together and hope for the best outcomes for Manitobans through this pandemic, the work continues. But we take moments here and there to remember how far we've come. I am grateful every day for the work of our task force, for every immunizer and staff member at all of our clinics, for every Manitoban who has done their part to protect themselves, each other, our communities, and our healthcare systems. A year ago, when Dr. Sharkey received his vaccine and Lori-Ann Laramie delivered that dose, I'm sure that none of us could have predicted the journey that was about to begin. You are both deserving of honor for demonstrating your personal and professional leadership. I thank you for it, and I'm sure that your families do too, as well as all of those that you work with. I would like today to present you with a special letter of appreciation from Her Honor Janice Filmon, the Lieutenant Governor of Manitoba. Her Honor wanted you both to know that it brings her pride to thank you for your role in the Protect MB campaign, for both what you did 1 year ago and for what you've been doing every day since in the practices as healthcare providers and with the task force. So I'm going to ask you to please accept these letters from the Lieutenant Governor along with my appreciation as well. And Dr. Sharkey, I'll now invite you to come to the microphone to share a few words with us.
In early December of 2020, there was a serious outbreak of COVID-19 at Victoria Hospital. The other family doctors and I were asked to transfer the care of our patients to hospitalists in order to reduce the number of attending physicians who might be at risk of infecting patients on the ward. So I agreed. It was a difficult decision for me because I feel this is an area where I can make a difference. But I gave it up because I did not want to be responsible for making any patients sick. Also, I had a healthy respect for the fact that I am over 60. And the outcomes for people over 60 aren't as good as for younger folks. So I was vulnerable too. And I got a chance to get the COVID vaccine. Receiving the vaccine allowed me to go back to looking after my patients in urgent care, on the hospital wards, in assisted living facilities, and in their homes. I'm more comfortable practicing in my office knowing that I am much less likely to transmit COVID to my patients or bring it home to my family. I just want to do my job, and the vaccine let me do that. I sleep better at night knowing I am less vulnerable. I'm truly grateful to all those involved who have given the opportunity to receive the vaccine. Dr. Reimer and her team have given us clear and frequent updates on the vaccines. So we, in turn, have been able to confidently encourage our patients to receive this life-saving preventive measure. Thank you.
Thank you very much, Dr. Sharkey, for your comments and again for stepping forward, both of you, and leading the way in terms of encouraging Manitobans to get that life-saving vaccine. Thank you. I'll now invite I want to call him Dean because he was my Dean when I was in my master's program, but it is President Ben-Arash to the podium to say a few words. Thank you.
Thank you, and welcome this morning. And so I am Michael Ben-Arash, President and Vice Chancellor of the University of Manitoba. And it's my pleasure to welcome everybody here today to this really historic day. You know, I want to extend a special welcome to Minister Gordon, Dr. Reimer, Dr. Sharkey, and Lori-Ann Laramie. I just want to tell everybody I can't help promoting the U of M. They're all graduates of the University of Manitoba. They're all alum. Some of them have more than one degree from here. So I want to encourage all Manitobans to get more than one degree at the University of Manitoba. But 1 year ago today, at this Bannatyne campus, the very first COVID vaccine were administered in the province. And I remember when we received the request from the province that the University of Manitoba would be that spot. We had, at the time, we had the space, we had the freezers, which was, if you recall, a year ago was an issue, and we provided the logistical support. And it was an easy decision. This was what Manitoba needed, and as we've heard, we've had 2.5 million COVID vaccines administered in this province since that time. And we are really grateful to our frontline healthcare workers for the work that they've done in making this possible. We know that our medical professionals have taken on exhausting workload in service to the health of our province, but with the exceptional leadership that we see here today, and from many others, including Dr. Brent Roussin, Marsha Anderson, Melanie McKinnon, Jazz Atwald, Jason Kinderchuk, and Anand Kumar, to just name the few. Our province owes you all a sincere gratitude. And while so many graduates of our university are working on the front lines, many others are making their impact through research. And at the University of Manitoba, if you don't know, we've been involved in the clinical trials that discovered how the blood thinner Hairapin can improve patient survival rates and reduce the need for respirators. We also have ongoing research projects investigating the condition known as long COVID, and another examining how key receptors for the virus works. We are this province's research university, and we are honored to work with partners throughout the province to bolster the health of Manitobans in this changing time. Today, we celebrate really the leadership and successes of Protect MB campaign. It has been our honor to be a part of this, and we see this as our responsibility as a university. Before we close, I'd like to ask Lori-Ann Laramie to come and please say a few words.
Good morning, everybody. Thank you for having me. So I would just like to take the opportunity to talk a little bit about what that day a year ago meant to me personally, as well as chat a little bit about what the days in between have looked like as well for me. So December 16th, 2020 was certainly a highlight in my career for me to have the privilege to be part of the delivery of the first COVID vaccine to Manitobans. So it did mean a lot to me personally. But what I quickly realized that day and in the subsequent days to follow was what it meant to all of the people that sat in the chair in front of me in those days to come. So like Dr. Sharkey, that day represented so much, I think, to myself and Manitobans. It was a day that of happiness as it represented hope for our province. It was a day of sadness for me. I feel like Dr. Sharkey and I had a little emotional moment when you sat in the chair. And I think I just saw and heard so many of the stories of what my colleagues had seen in the months previous to the first vaccine being delivered. It was a day of celebration of science and a groundbreaking vaccine. And it was a day of admiration for myself to see a team who in only a short couple days were able to plan and execute a vaccine campaign that was going to take us, at least 365 days later. So that was, I was very proud of the team that I was involved with at that point. So fast forward 365 days later, here I am. As we mentioned before, I've transitioned over to a role in the vaccine implementation task force with the province, and since have had the privilege of being part of moving vaccine and planning and implementing clinics to every corner of this province. I have never been so skilled at knowing where small towns and my high school teacher would be proud of my geography skills of our province of Manitoba now as a result of this position. But we've been very successful at moving vaccines to super sites and pop-up clinics to focused immunization teams, medical clinics, doctors, pharmacists, and independent immunization partners across the province. The admiration for the teams that I work with has only grown. I've witnessed firsthand the endless dedication and hard work of every region in this province as we moved through our original target of 70% of dose 1 to dose 2 and now booster doses, as we launched campaigns for 12 to 17-year-olds and more recently the 5 to 11-year-olds to keep our province protected against COVID-19. Manitoba has responded and will continue to do so as we look to implement our plans to provide vaccine to all of those that aren't currently eligible. Dr. Sharkey, it was a privilege to start this journey with you, and I hope that your subsequent needles were as good as your first one with me. And I thank you, everybody, for your time today.
I want to thank everybody for their thoughtful remarks and for all you've done throughout this public health emergency. We know there's still much work to do and challenges to address, and we continue to encourage everybody to get vaccinated and now get their third doses. The University of Manitoba is committed to demonstrate leadership and support crucial efforts, including doing our part to increase the number of nursing seats in this province, and we welcome yesterday's announcements from the province of long-term funding to support that effort. Thank you. Merci. Miigwech.
All right, folks, we got time for a couple questions on this announcement only for now. How many questions on this now? Go ahead. For just on this announcement?